Got another handout coming here as well. Lots of trees. All right, you don't need anything else out today. Okay. You can put everything else but the handouts away. Okay. We are, this second one that I just handed out to you with the star on the front, you can put that one underneath for a little while. I'll just have you pull this out later. But the main one is the one that's got a lot of stuff for you to fill in as we go through. That's the one that you probably need to have out in front of you. Yes. Yeah. Wow. Not sure what to do with that. No, that's it'll make sense later. All right. Okay. What I want you to do is at the top of the handout there, contraception and humane vitae. Humane vitae, I want you to write in what that means. That's Latin. It means on human life. On human life. At the very top of the handout, it says contraception and humane vitae. That's the name of the presentation we're going to look at today. And humane vitae is Latin for on human life. Okay? Questions on that? We are going to be looking to... Oh, I'm sorry, go ahead. On human life. So it's a letter that was written in 1968 about human life. Okay, and we'll get into that here in a little bit. But we're going to look at what the church has to say about contraception and why. All of your questions hopefully will be answered. Okay, we have some videos today and so on and so forth. We're going on the World Wide Web with this class, so behave. No, everyone, your parents will be able to watch you if they want. Yes.
Live streaming?
Not live streaming, just live YouTube. It's not really live, but on YouTube, I'll put the YouTube thing on my blog. Some of the classes I put up on the blog so people can kind of watch if they want. So, oh, we're rolling. We're live. We're live. I want to look really quickly before we start at a commercial that's airing right now on contraception, the contraception pill. Okay, it's an advertisement, and I just want you to kind of watch it and see what you think.
You know what you want today, but you never know what you might want tomorrow. It's good to have choices. It's good to have Biaz from Bayer. Like all birth control pills, Biaz is effective at preventing pregnancy and may give you lighter periods. And if you choose Biaz for birth control, it may help treat moderate acne and premenstrual dysphoric disorder, PMDD, not PMS, and also contains folate. Folate is a B vitamin recommended for all women in their reproductive years. With folate, Biaz reduces the risk of rare neural tube birth defects during use and shortly after stopping. Biaz is a different type of hormone that for some may increase potassium too much. So don't take Biaz if you have kidney, liver, or adrenal disease, because this could cause serious heart and health problems. Tell your doctor if you're on daily long-term treatment for chronic conditions like cardiovascular or inflammatory diseases. Serious risks include blood clots, stroke, and heart attack. Smoking increases these risks, especially if you're over 35, so don't smoke on Biaz. Don't take the pill if you've had any of these conditions, certain cancers, or could be pregnant. The pill does not protect against HIV or STDs. Ask your healthcare provider about Biaz, because it's good to...
Let me get the mic back on here. Yes. What's your question?
Tell me why. Alright. They talk real slow when they start introducing me. When they start taking the side effects, they start talking about fast.
Well, they always do that. Yeah. I mean, any medication that you see, it'll always be at the end of like, this pill may cause you to kill yourself and may cause you to go on a murderous rampage, but it's like 900 miles an hour, you know. Yeah. Okay. I believe everything is, yes, okay. I think that someday, the day will come, 100 years from now, 50 years from now, whatever it is, where when you watch History Channel shows on the Nazis, They show things from the Nazi Germany that were being aired on television and whatnot that were propaganda. I think that we will look back on a commercial like this, and because people will be asking the question, why in the world was abortion, why did they ever stand for that? Why did they ever stand for contraception even? And I think that we will either be looking at this, or our society will be, we won't be around anymore. Okay? I really believe that. This portrays, as Kari said, everything is an option, right? Look, I'm not ready for kids. I'm going to wave off the stork, and I'm instead going to get the Paris vacation I've always wanted, and I'm going to get the nice house. And I can choose men like Barbie dolls, right? I'm going to take that man, or I'm going to take that man, right? All these different things that are out there, it's portrayed as, oh, contraception is so great because it will let you do all these things. I mean, really quickly, I mean, from the church's perspective, you would see that and you would say, how selfish, how disgustingly selfish. Okay? We're not today talking on the blog. Somebody got mad at me because I post things about contraception sometimes, and someone was like, I have cervical cancer and the pill helps me. Okay, look, that commercial is not trying to get you, if you have cancer or you have problems with uterine problems or so on and so forth, where there are certain times where it actually functions as a medicine. Extremely rare. I know a good doctor here in the area who is very highly respected, and she has only prescribed birth control. She believes what the church says, and has only prescribed birth control one time in her entire career, where it couldn't be treated otherwise. The problems that she saw: excessive bleeding, issues with cramping, even uterine cancer and those types of things. So it's not that. The 99.999% of people who use contraception are somewhere that commercial appeals to me. I'm not ready. I can't afford a child. I want to do my own thing. I want to go to grad school, like the thing said, and that's why I'm choosing then contraception. Okay? We're going to look today at what the church teaches about contraception. And it's very important. I think it's a great discussion today. Before we get there, before we do that, I want to look at another video really quickly. But first, what is contraception? Hopefully you know that by now. We talked about it last semester. We're talking about condoms, birth control pills, IUDs, which are intrauterine devices, which you have shots, you have patches, the Deprova patch, so on and so forth, that can help eliminate, or regulate ovulation and so on and so forth. They're all designed to prevent or eliminate pregnancies. Okay? We're going to look at here quickly a video that talks about there are three things that the pill does, that the contraceptive pill does. And we're going to watch this video because people typically only know about the two of them. A third thing that the pill will actually do is it can cause abortion. It can cause an embryo which has been conceived to not implant on the mother's uterine wall and instead to be passed out in the typical menstrual cycle, so that you have an embryo that dies because of the pill. This video will explain it. It's not quite a miscarriage. You don't experience it as a miscarriage because when it's that small, when the embryo is that small, it still and it hasn't even implanted on the uterine wall, you wouldn't even notice it. Okay? But we're going to look at this video and kind of explain, and just the lack of misinformation, even on the part of women that are out there today about what the pill does. So many women are taking it, so few know what it really is. Okay? And so we want to watch this. I think it's a very informative and helpful thing to kind of start our discussion with. So we'll check this out.
So I read through that and was just really shocked and surprised and wondering how I had never heard anything about that before.
No, I don't. Women, in general, women are not being informed. And what I'm suggesting is that sometimes the doctors just don't think about it as an issue.
That is almost pathetic that I don't really know.
It's probably an issue of a lot of people is that they don't really understand how it works. They may know that it helps you not to get pregnant, but they may not necessarily know like the background health information about it.
I don't know. It has something to do with hormones, and I
I've been told that it tricks your body thinking that you're pregnant already.
Yeah.
That's pretty much it.
And
I was never told by any doctors anything.
And I think that's part of the reason that there's so many healthcare professionals that don't know about this debate, this controversy, this theory. But so many women don't know, and we could also say so many husbands don't know, and so many moms and dads don't know, and so many pastors don't know, and so many Christian leaders don't know. I heard about it from my partner. I was practicing in Kissimmee, Florida, a little town near Orlando. My partner came back from a conference and said, I've heard that the birth control pill can cause abortions. Have you ever heard this? I said, absolutely not. In fact, I don't think they can. And he said, well, here's some literature. Why don't you read it? So I read it, studied it, and I came back to him and I said, his name's John Hartman. I said, John, I think this is a bunch of rubbish. And he said, well, why don't you prove it?
I guess it stops the female from the egg with the sperm to fertilize.
I can't say I really know for sure how birth control works. I know it has something to do with adjusting your hormone levels, but beyond that, I'm not really sure how it works.
I haven't gotten pregnant, so I guess that it works to the best of my knowledge.
Stops you from ovulating, so you still have your period, but it's not the same as if you were not on the
The woman's normal menstrual cycle involves the ovary, cervical mucus, and the uterine lining. In a normal cycle, a woman releases an egg every month due to the natural hormones estrogen and progesterone. For a woman on the pill, the artificial hormones usually prevent ovulation. Secondly, in a normal cycle, the cervical mucus changes to improve sperm migration. For a woman on the pill, the cervical mucus thickens to prevent sperm penetration. Thirdly, the natural hormones in a normal cycle cause the lining of the uterus to build up in preparation for a newly conceived child to implant. For a woman on the pill, the artificial hormones cause the lining to shrink and do not allow it to mature properly. So if the first two mechanisms of the pill fail and the woman does ovulate and conceive, implantation of a new child may be hindered, which would be an abortion. Many medical textbooks, pharmaceutical manuals, and government resources include the third mechanism.
The CPS is the Canadian Drug Reference for healthcare professionals. Almost all of the entries for oral contraceptives mention changes in the endometrium. Now, when we went to the pharmacies and got the patient information which comes in the pill packages, the inserts that do mention how the pill works only give two mechanisms of action: inhibition of ovulation, thickening of cervical mucus, leaving out the effects on the endometrium.
The Physician's Desk reference is the American Drug Manual for Healthcare Providers. All of the pharmaceutical companies which gave entries for oral contraceptives mentioned the three mechanisms. When we looked at the American inserts, we found all three mechanisms under the clinical pharmacology section. However, in the information for the patient section, there was no mention of how the pill works.
That when we were doing our research, we found that in the Physician's Desk reference, every birth control pill is required to print the mechanism of action, how the birth control pill works. And the PDR says there's three mechanisms. One, decreases ovulation. Two, thickens the cervical mucus. Three, alters the endometrium so that implantation is less likely. But what about the handouts that are given to women? that are also required by the Food and Drug Administration. When we did our study, all of the birth control pills except one excluded that information. They said decreases ovulation, thickens cervical mucus. But in the information given to women, it did not say that the endometrium could be altered. We wrote every one of those companies as part of our study. None of them gave us an answer. Since then, those handouts have been changed, but not for the better. Now, none of them, to my knowledge, none of them mention any of the effects in the patient education. They ignore it. And I think that's part of the reason that not only so many healthcare professionals, but so many women just don't know about this issue, about this controversy.
All right, questions? Yes.
What was the third way that they were talking about that seemed so shocking that no one was placing it in their information?
Anybody understand it? What's the third way? Why doesn't it? What does the pill do? It thins the wall, the wall on the mother's womb, basically, of blood and tissue that typically is there to accept the implanted embryo and let it implant, I should say. The pill thins that out so that if the other two mechanisms fail, that third one, the embryo would become fertilized by the sperm, or the egg would become fertilized by the sperm and become an embryo, but wouldn't have a place to implant solidly because it's been thinned out, so it would pass out like with the normal period. Even though it is a fertilized and it's an embryo, what we consider to be a human life. Yes?
I don't understand how they didn't know about that part.
Who didn't know? They're saying they're keeping it quiet. They're saying that the companies up front, if you look in the really hard to find places, they'll tell you about that third option. But the things that they give to the patients never mention that.
Yeah, no, I mean that research guy.
What about it? I'm sorry.
Like I don't know why he wouldn't know.
Good question for my sister-in-law, Carrie. When she comes to school on Monday, she is currently a pharmacist. She went to 6 years of school at Purdue. She did not, at the end of that 6 years of pharmacy school, have any idea about what the birth control pill did. They learned about natural family planning, which the church's response to this, which they'll get into more than I will today. She didn't know any of that after the end of 6 years of pharmacy school.
Because it obviously breaks down that lining, because when you're on the pill you don't even have periods.
Okay.
What?
When you're on birth control, you don't have a period. You have periods 4 times.
They're regular 4 times a year. Or if there are some applications why it's lighter is because that lining isn't being full.
Right. Yeah. That would be a question for Carrie, I think, and she would have an interesting answer. Why no scientists or anybody have any idea about what the pill does, let alone the average woman on the street who's taking it. Right. Some estimate, you read estimates online of how many abortions. There's been 54 million abortions since Roe versus Wade in our country, where the child has actually been aborted in the womb. There's estimates of some places have it as high as another 100 million abortions that have occurred through the pill. Now, sometimes that happens naturally. Sometimes the egg is fertilized, but it still fails to implant. And so people say, well, you didn't cause it when that happens. If it happens naturally, that's one thing. If the embryo doesn't implant for whatever reason, then that was God's plan or whatever. Okay? But, yeah, what?
I just said that I knew what she was talking about.
What's that?
That there's, or at least I know there's some kind of treatment or something that can make a woman go through their menstrual cycle every couple months. I don't know what it is. I don't know if it's technically. I actually want to know the answer. I don't know what it is. What pill it is. But I've heard of it too.
Well, again, Carrie can give you the different breakdowns of the more specific stuff of the different options that are out there in terms of the pill and everything, and the different medicines. That's what she does every day. So she would be a good expert to ask on that. But if it either A, thins your uterine lining, or it makes it go away altogether, either way, you're making sure that the pill causes the embryo to not implant. So that's the issue. Yeah.
And I heard that even if like you're on the pill and then you stop taking it, that lining is still altered in a way, and you can still like not be able to bear children after.
There is studies going on out there that birth control pills, even after you stop taking them, can affect your ability to get pregnant. Yes. That can be a long-term effect. Again, Carrie would be the one to ask on Monday in terms of where that research is at. Yeah. Is that your question too, Rachel? Okay. All right. So let's get into this then. Why does the church care? Okay. What does the church say about this stuff? You have on your hand out there some things that we need to write down. All right. History of contraception. Up until 1930, all Christians were in agreement that all forms of contraception, always and everywhere, are morally evil. Up until 1930, okay? In 1930, the Lambeth Conference for Anglicans changes that. The Anglican community has a conference. They get together. They do it frequently or regularly. I know in 1930, at this conference, they vote to allow contraception to be used in certain cases. Other Christians follow suit. Other, Baptist denominations, Episcopalians, all the different Christianity, forms of Christianity go along with mostly the Lambeth Conference over the course of probably 20 years. Okay, so that by the time of the start, when does Vatican II start, by the way? 63. Okay, it starts in 63. So by the time of the start of the Second Vatican Council, everyone else but the Catholic Church has caved on the issue of contraception. Okay, that's a very key thing to know. When the Vatican II starts, the Catholics are the last people who still say it's morally evil to use contraception. Okay? What's the first question? I can't remember exactly. When and where did Christians first cave on the issue of contraception? 1930, Lambeth Conference. Okay? Most other Christian denominations follow suit soon after that. Okay, so you have the Catholic Church. You also have the Orthodox Church, which is very similar to the Catholic Church. But other than that, most of Christianity has caved on the issue by 1963, when the Second Vatican Council starts. Why? This is very important. This guy named Thomas Robert Malthus was writing at the turn of the 1800s. He says a very important thing. Okay? And this mindset is still out there. I know because I talk to people on my blog who think that this is still true. Okay? A lot of very smart people who believe this. Malthus comes out and says basically that population is growing geometrically. We know geometrically from math, right? Geometric means it's a curve and it's increasing more rapidly each year. Okay? Exponential growth, geometric growth mean the same thing almost. Exponential is actually just even faster. But geometric growth it's a curve. It's going up and up and even quicker. Okay? He said that the world food production is growing linearly. So, and other people now have said all resources, gas, coal, all these resources that we rely on are growing linearly. Okay? They're not increasing at a curve. They're growing linearly. So what happens once you get past this pot? Not enough food, not enough resources, the population now for what we need. Okay? We're going to run out of room. We're going to run out of food as the world, so let's go ahead and use contraception. People are actually thinking, first of all, we need to start using it. It's the responsible thing to do. It's irresponsible to have children because we're going to run out of stuff. Right? Okay? This mindset is still out there by some people. Some people still believe that. Even though the entire population of the world can fit inside Texas, and everyone has like a quarter of an acre. Okay? A quarter of an acre inside Texas, the entire world's population, whatever it is, I think it's getting close to 7 billion. Okay? We all fit in Texas. The United States, every reasonable study that you will come across, the United States has enough food to feed the world, let alone all the other countries. Okay, we have enough food in our country to feed the world. So the issue, a lot of times when you see starving children on television, the Christian minister or whatever with them, and you know, a lot of times what's going on there is that you have issues of war, you have other issues in terms of corrupt governments, keeping food and resources from these people. It's not that there is not enough food. Okay? We eat, you know, the average diet of an American today is off the charts in terms of the number of calories that we take in. We have enough food, it's not questioned, really, that we can feed the world. Okay? So, this guy has been proved wrong, but a lot of people still believe that. And what else has happened? Well, the resources have grown, they've actually been growing exponentially. We saw in Food Inc., right? What's happened just in the last 10 years with the production ability of the average farm? It's like grown by 20 times. They said, I think it was like 20 years ago, it was like the yield was like 10 to 1. I can't remember the numbers, but I remember it being like almost 20 times better than it was 20 years ago in terms of the average farm today. You guys remember that from Food Inc.? Our food is growing, we're not running out of food. Okay, so this guy's been proved wrong, but people still think that way. Questions on that? Can you explain that back to me on a test or whatever? Justine?
Well, didn't you say that the production of children has also decreased?
The production of children has decreased because of contraception, exactly. Yeah, we'll get into that. But
Is it because of contraception, or is it just because people don't want to support that many children anymore? People don't want to support children.
I think people don't want to support children. Typically, at least in the West, the civil, you know, the rich area, Europe, France, Germany, England, the United States, don't want to have children because of the things that you see on the commercial there at the beginning. Sometimes, most of the time, and so we're dropping off to the point where we're not replacing our own population, which is the irony of all this, and we'll get into that. Okay, now the population is still growing geometrically because of the poor areas of the world that are still having children, which is the irony. We can't afford children. The poor people in Mexico are having the children, and in Africa and stuff, and we're not having children because we can't afford it. So yes, the population is still growing, but in our country, what's going on? You guys maybe weren't paying attention to this a couple of years ago. In France, there were a lot of riots because the Muslim people are being oppressed in France, but they're becoming the majority because the Muslims treat contraception as always and everywhere wrong. Okay, so they're still having kids. So they're flooding into all these countries, especially in Europe. Just like most of the time in our country, we have a lot of Mexican people coming to our country because we don't have enough people to fill the jobs we have. Why? Because we're not having kids. So poor people from Mexico are coming in here a lot of times to fill the jobs that we need. We're letting it go on. And I'm not getting into the immigration debate at all right now. I don't want to go there. But I'm just saying we have to acknowledge the fact that if it wasn't for Mexican people coming to our country, our population would now be almost on the decrease as well. Okay? So you have people filling into the rich areas of the world from the poor areas because they're still having kids, helping save the rich areas of the world because they don't want to have kids. All right. The timing of Humanae Vitae. Humanae Vitae comes out of Vatican II, okay? So you have the sexual revolution of the 1960s going on, and a lot of people think, oh, well, so we're in a new era. We're in a new era. We've sexually liberated ourselves. Vatican II and the sexual revolution occurred at the same time. Some in the church forget that they were two separate events. We have Catholics, a lot of Catholics in our country who think that Vatican II was some kind of confirmation of the sexual revolution. Oh, Vatican II happened in the 60s, so did the sexual revolution. So it must be that the Vatican II was all about sex.